It takes a team, providing evidence-based care to people living with substance use disorder. Care teams in outpatient settings can identify and support people who are living with substance use disorder, or SUD, in a variety of ways. This brief video will highlight a few strategies and tools care teams can utilize when screening and referring patients to appropriate specialty treatment services. More detailed information is available for each of these areas in a learning module developed by Quality Insights in partnership with the Pennsylvania Department of Health and Shatterproof, titled It Takes a Team, providing evidence-based care to people living with substance use disorder. Introduction. The opioid epidemic affects every walk of life. Rich, poor, black, white, young, or old, the opioid crisis is unprejudiced in its reach and devastation. Nearly 15 Pennsylvanian lives are lost each day due to unintended drug overdoses. Nationally, an average of 44 people died each day from overdoses involving prescription opioids, totaling more than 16,000 deaths in 2020. With record high numbers in both Pennsylvania and across the nation, continued work to identify patients who may be at risk of SUD and support those living in recovery is critical. Care Team Strategy, PDMP. Care teams play an invaluable role in identifying SUD, referring individuals to specialty services, and supporting patients living in recovery. Effective communication and efficient use of the Pennsylvania Prescription Drug Monitoring Program, PDMP, can help prescribers and dispensers make evidence-based clinical decisions and limit drug diversion and misuse. To make consistent use of the PDMP more practical, prescribers and dispensers are authorized to grant PDMP access to delegates for the purpose of searching the system on their behalf. There are a variety of workflow options that delegates can use to search the PDMP and share pertinent information with providers for SUD diagnosis and management. Screening tools and treatment agreements. The care team can act as the first line of defense in identifying patients who may have a SUD by using a validated screening tool. Validated tools are important for an accurate understanding of a patient's risk of substance use disorders and are more likely to correctly identify patients with substance-related problems and disorders. One example of an evidence-based screening tool that is appropriate for primary care settings is the National Institute on Drug Abuse, Tobacco, Alcohol, Prescription Medication, and Other Substance Use Tool, also known as the TAPS tool. This assessment consists of a combined screening component, TAPS 1, followed by a brief assessment, TAPS 2, for those who screen positive. Screening results can be shared with the patient to start a productive conversation about their substance use and discuss strategies to reduce their risk. Communication strategies. Words shape how we view and treat people, and can intentionally or unintentionally promote stigma towards individuals who use substances. Person-first language paired with motivational interviewing techniques ensure conversations with patients are non-judgmental and build a trusting relationship with each member of the care team. A few key steps to consider when interacting with patients include: pause. Notice your reaction to the person. Think. What could the person be thinking and feeling? What do they want you to understand about their perspective? Be curious. Ask open-ended questions. Listen. Try to understand their point of view. Explore options. Exchange ideas about what to do next. Recognize success. Acknowledge that change is hard and give credit for small steps. Community resources. When a patient screens positive for SUD, referral to specialty treatment services may be appropriate and recommended. A warm handoff is a collaborative effort between two members of a patient's healthcare team for the purpose of improving the connection and reducing the gaps in services the patient will receive. The warm handoff process directly connects a patient with specialty services and helps reduce gaps in care. If a patient refuses a referral for assessment and treatment, care teams can provide the patient with a naloxone kit or information about how to obtain naloxone, along with educational information about local and online treatment resources. Many treatment locator tools are available to assist Pennsylvania healthcare teams in connecting patients to treatment services. A few primary options include calling 1-800-622-HELP, calling or texting 988, or chatting 988lifeline.org, contacting your local single county authority, or visiting the Atlas Treatment Locator website. Defining recovery. SAMHSA defines recovery as a process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential. After treatment for SUD, patients living in recovery will need continued care and support, just like any other chronic disease. Strong provider-patient relationships and outpatient care settings offer an advantage in supporting recovery, along with treating the physical health problems that may result from SUD. Conversations surrounding recovery, mental health, and medication management can be ongoing through a series of outpatient appointments and supported by a high-functioning care team. Trauma-informed care for patients living in recovery. Along with general care team principles, more targeted trauma-informed care team approaches can be utilized to support patients living in recovery. The relationship between trauma and substance use disorders is complex, but there is no doubt that experiencing a traumatic event can be a trigger for drug or alcohol use in vulnerable individuals. Trauma-informed care acknowledges that healthcare organizations and care teams need to have a complete picture of a patient's life situation, past and present, in order to provide effective healthcare services with a healing orientation. Additionally, patients are offered the opportunity to engage more fully in their healthcare, develop a trusting relationship with their provider, and improve long-term health outcomes. Conclusion. Primary care and other outpatient healthcare settings may be the only opportunity a patient has to engage in a meaningful conversation about their substance use or recovery on an ongoing basis, providing an ideal environment for SUD screening in connection to treatment and recovery services. If you are ready to engage your care team in addressing the opioid crisis in Pennsylvania, Quality Insights invites you to participate in a no-cost virtual or in-person learning session with your practice. Connect with us today for details at pdmpeducation@qualityinsights.org.